Hello everyone, this is Regina Callion from www.remarreview.com, and we're going to go over some Nclex questions. So why don't you get out a pen and paper and go through these 10 questions. Once you write down the answers, at the end of the 10 questions you will see we will go over them together. Okay, here's the first question. Let's get started. Okay, guys, now let's go over the answers to see how well you did. The first question has A nurse is caring for a client diagnosed with a sexually transmitted disease. The prescribing doctor orders penicillin G. Which statement is false concerning the medication penicillin G? Well, that's going to be B. Penicillin G does not work best orally. It should be given IV or IM. Did you know that? Let's move on. Which antibacterial is generally safe to administer during pregnancy? The best choice for Nclex is going to be cephalosporins. Now remember, you can also give which antibacterial as well? You can give penicillins during pregnancy. Those are the two ones you want to look out for. Question 3. A nurse is preparing to administer vancomycin via a PICC line to treat MRSA. The nurse is aware the action of the medication will do which of the following? Vancomycin is a cell wall synthesis inhibitor. Question 4 says, a 23-year-old female is newly prescribed Phenytoin. Which statement made by the client indicates an understanding about this medicine? So you have to demonstrate what do you know about Phenytoin, and B is the only one that is true. This medication can treat grand mal seizures. Do you know what a seizure is? Do you know what the types of seizures are? You should know that for Nclex. Let's go on to question number 5. What is the best position after a tonsillectomy to help facilitate drainage of secretions? Side lying is the best position to facilitate drainage. There is another position that helps with drainage facilitation, and that is the prone position. Question number 6 is a sliding scale question. You have your sliding scale and you see that the patient's blood sugar is 329. So if you look at your sliding scale, anything between 300 and 349, you should give 12 units of regular insulin. You had another sliding scale question. In this sliding scale, you are given a blood glucose level of 419. So according to our parameters, any blood sugar over 400, we should hold all insulin and call the doctor right away. So we would not give any units of insulin here. Question number 8, a nurse is writing a care plan. Risks for impaired skin integrity related to immobility and dry skin. Which of the following represents a properly stated outcome or goal? C is the only statement that is an outcome or goal. All of the other ones are what? Interventions. 9. A nurse is administering chest compressions to a client in the public cafeteria. The nurse's aide brings the AED machine. The nurse turns the AED on and places the electrodes. The AED fails to analyze the rhythm. She should now do which of the following? The safest thing for the nurse to do is put the AED away and continue chest compressions. This is the only option that will keep the patient alive. The other ones will delay treatment for your patient, which means your patient will be dying, okay? So we always want to pick the safest answer for our patients. And the last question. A nurse is in a cold blue situation with 2 other registered nurses. The client has just been defibrillated and is receiving cardiopulmonary resuscitation. The first drug the nurse should prepare to give is which of the following? That is going to be epinephrine. Even though your patient was defibrillated, if they're still receiving CPR, that means that there is no pulse. So we need to give epinephrine. Well, how did you do? You gotta know that content, guys. So if you are ready to get started, just hit up the Nclex Packages tab and pick the program or the product that is right for you. Alright guys, thank you for studying and watching ReMar review videos. I'll see you soon. Bye-bye.